I'm Michele Sotelo. I'm the after-hour on-call nurse with Angel's Grace. So I like to consider myself almost like a paramedic of hospice. I support the families usually when they're in most time of need, when they're in a crisis or they're having difficulty with symptom management or at time of death, or sometimes when our patients fall and they get injured, then I get sent out. I've been a nurse for 20 years, so I've had a wide variety of backgrounds, and what I really like about the on-call position is that I'm really able to use a lot of my critical thinking skills and a lot of my skills that I've learned over the years in acute care nursing to kind of figure out and problem solve what might be going on with the patient when I show up for an on-call visit. The case managers are really good about kind of updating me specifically what's going on with their patients as far as if they're transitioning or if they're imminent, close to death, so that when I walk into the home or the facility, I have a better idea of kind of what's going on with the patient. Not always. Sometimes I get those patients that kind of change condition rapidly, and then it's just kind of getting in there, trying to assess what's going on with the patient and figuring out what the next step is for their plan of care. There is nights though, especially during like colder months, it's hard. It's hard to get up at 2, 3 o'clock in the morning out of your nice warm bed. But I always remember, my first thought is always, if this was my mother or my father, my grandfather, this is who they need right now. They need the support, and sometimes just my presence, just really comforts them. Families need us at all hours, and we would rather them call us than panic and call, 911, because we don't want that scenario for anybody that's going through the dying process on hospice.